Congenital malformation or anomalies are defined as anatomical or a structural defect present at birth with or without functional impairment. Although used interchangeably, the term congenital anomaly has wider connotation that is structural, functional, biochemical, and physiological disorders of prenatal origin. Structural malformation may be broadly divided into major malformation with a significant functional impairment, that is congenital heart disease and the neural tube defect, and the minor malformation without direct functional implication, that is preauricular skin tags. Next, congenital malformation are third commonest cause of perinatal mortality in India. Despite underreporting, this malformation are estimated to be present 2.5% of the newborn birth, and the incidence may rise to 4.5% to 5 years as many defects manifest in a later life. Over 60% of congenital malformation are idiopathic, and the rest due to various intrinsic, there is a genetic defect, and extrinsic, that is environmental factors. The teratogens is applied to those environmental influence which are known to have definite exposure risk relationship with a congenital anomaly, that is maternal infection, torch infection, drugs during the pregnancy, radiation during the pregnancy, and maternal alcohol and smoking habits. Only 10% of malformation are due to recognizable teratogens. Next, congenital malformation may be single primary defect or a multiple malformation syndrome depending on etiology, and the secondary effect. Various terms are used to denote this defect as follows. So what is malformation? The malformation, that is single morphological defect due to intrinsic error in embryogenesis and organ differentiation, that is cleft lip and congenital heart disease. Deformation. What is deformation? Abnormal shape and the position of a normally formed body part due to abnormal uterine pressure or a posture. There is a congenital dislocation of hip or a congenital talipes equinovarus. An abnormal posture may be due to extrinsic uterine pressure, that is oligohydramnios, intrinsic fetal hypotonia, that is neuromuscular disorders. What is disruption? Disruptions, there is a destruction of normally formed body parts in a late gestation due to tearing or amputation of the structure by floating strands of amnion, that is amniotic band syndrome, loss of digits of the limb, and interruption of blood supply due to infection, trauma, and other teratogens, leading to distal infarct, necrosis, and resorption. There is intestinal atresia and porencephaly. Dysplasia. Dysplasia denotes abnormal organization of constituent cell in a structure leading to abnormal growth. Dysplasia may be localized. There is hemangioma or generalized and skeleton dysplasia. Being growth dependent, clinical appearance in this defect tend to change with the age. Hemangioma may regress or a skeleton dysplasia may deteriorate postnatally. Sequence. Sequence denote a spectrum of multiple malformation due to cascading effect of a single primary defect in morphogenesis And depending on the primary error, the sequence is further classified as malformation, deformation, and disruption sequence. And some common sequence include there is Robin malformation sequence. Robin malformation sequence with a primary defect of mandibular hypoplasia leading to macroglossia, glossoptosis, and high arch palate. Breech deformation sequence due to abnormal uterine pressure in the breech position leading to abnormal skull shape, facial asymmetry, torticollis, congenital dislocation of hip, congenital talipes equine varus. Similar abnormality are also seen Potter sequence due to oligohydramnios. Amniotic band disruption sequence due to disruption of normally formed amniotic membrane leading to defect that is cleft lip, limb defect, and aplasia cutis. Sequence needs to be differentiated from multiple malformation syndrome as a recurrence risk in them depend on a primary defect. Multiple malformation syndrome denotes presence of one or a more developmental abnormality involving at least two different systems due to an established cause. Most of these defects are chromosomal or polygenic in origin, that is Down syndrome, though other may be due to single gene defect or environmental factors, that is intrauterine exposure to infection-caused infections and the drugs, congenital rubella syndrome or fetal hydantoin syndrome. Association. Association denotes a non-random, more than by chance, occurrence of multiple malformation in combination, not explained by common etiological basis, syndrome, or a consequence. Two common associations in case of congenital and neonatal anomalies. One is water association and second is charge association. In water association, it includes vertebral anomalies, anal atresia, tracheoesophageal fistula, esophageal atresia, and renal and a radian defect. In a charge association includes coloboma, heart disease, coronary atresia, growth and mental retardation, with or without CNS anomalies, hypogonadism, and ear anomaly or deafness. Common causes of congenital malformation. 60% of the congenital malformation, there is an idiopathy. But due to intrinsic or inherited, there is 25 to 30%. Chromosomal abnormality, there is a Down syndrome and a Turner syndrome. Single gene, there is achondroplasia and Holt-Oram syndrome. Polygenic, there is a cleft palate and neural tube defect and congenital heart disease. Extrinsic environmental cause lead to congenital anomaly. It is 10 to 15%. There is a maternal infection, rubella, cytomegalo, and toxoplasmosis. Maternal disease, there is a maternal diabetes and iodine deficiency. And the drugs and toxins during pregnancy, there is anti-epileptic drugs, alcohol, and hormones. Maternal smoking and irradiation also result into the neonatal congenital anomaly. Also maternal malnutrition and folic acid deficiency, it leads to NTD, there's the neural tube defect. And also it leads to uterine anomalies and oligohydramnios. Which are the diagnostic clues for a congenital malformation. So history taking is very important. So family history of malformed parents or a sibling. Second, parental consanguinity. Third, elder mother or father. Teratogens during pregnancy, there is torch infection, drugs, and alcohol. The drugs are the sodium valproate and carbamazepine. Maternal disease, there is a maternal diabetes. Oligohydramnios and polyhydramnios result into congenital malformation. So this is important. And abnormal fetal movements and abnormal presentation history is important for congenital anomaly neonatal. Also, clinical examination is also important in newborn to detect neonatal malformation. So first, external appearance, patency test or orifice count at birth, single umbilical artery, stigmata, there is a spinal hair tuft and auricular tags, and systemic examination in case of congenital heart disease. So how to diagnose neonatal congenital anomalies? Although most of the congenital malformation are obvious at birth and some may be easily missed in early life, an early diagnosis of major malformation is essential for survival, appropriate management, and prevention of late complication. Genetic studies are indicated in a selected case with the intrinsic cause of malformation to assess the risk of recurrence and prenatal diagnosis.